There are more deaths due to surgical complications worldwide than HIV, tuberculosis, and malaria combined. One way to reduce surgical complications is, instead of using an open approach where you create a large incision across the entire abdomen, to use laparoscopic surgery instead, where you use a few keyhole incisions, and then through one of those incisions you insert the laparoscope. And this provides the illumination of the abdominal cavity and also a video of what's happening in the body, so the surgeon can see what they're doing. However, laparoscopic surgery is not widely accessible in low and middle income countries, or LMICs. Over 90% of patients in Africa don't have access to safe surgery and anesthesia. So we've designed a low-cost laparoscope called the KeyScope that can be used throughout Africa. So to reduce the cost and complexity of the laparoscope, we eliminated the fiber optics and the laparoscopic tower and instead replaced it with consumer-grade electronics like a CMOS camera and ring of LEDs at the tip of the probe. We have been working with the Fischell Institute since 2020. We've been working with Kevin Aroom and John Raza to take the device from an initial prototype to a device that's ready for manufacturing.
So working with Dr. Mueller, this project had a unique set of challenges that's different from a lot of other projects we work on, in that we're trying to make things simple and robust enough to be able to be utilized in developing countries that can also allow them to build the products themselves, which is one of the major aims of her project, to empower the local population to be able to build the tools used in surgery.
The next steps are to prepare for a first-in-human clinical trial at the Ugandan Cancer Institute in Kampala. My goal is to enable laparoscopic surgery throughout Africa so that when anyone needs surgery, they can receive it in the safest way to the highest quality. Every time I go to Uganda, I'm reminded what the local Ugandans are up against. And it inspires me to keep going, because if they can do it, I can do it.